everybody, my name is Nicole Butler and this is my emergency response plan for cardiac arrest in a public setting. So we're going to be talking about cardiac arrest in a public setting, what to do, and an emergency response plan if this occurs or if this happens to you. So first things first, you want to recognize what is cardiac arrest. So cardiac arrest is when a person suddenly loses heart function. So their heart just gives up on them and just stops. So a victim can collapse, become unresponsive, stop breathing, or is gasping for air. And it can happen without any warning in any public setting. Actually, most of the time it does happen with no warning or any public setting. I want to make sure you know that cardiac arrest doesn't have a name on it, doesn't have a time, a place, or it doesn't have a specific person or audience that it attacks, because you can be the most healthiest person walking or the most illest person and you will still experience cardiac arrest. So this is cardiac arrest. So it can collapse, become unresponsive, stop breathing, or gasp for air. So some of the signs and symptoms of cardiac arrest is like I mentioned, suddenly collapsing on the floor, becoming unresponsive, not communicating or talking to you, not being conscious, or just having a loss of conscious. Like I mentioned, not breathing or abnormal breathing, so like gasping for air, can be experiencing discomfort or chest pains in their chest, having no pulse, or their skin can become cold-like and very clammy. So that's almost if they were like deceased or something. So these are some symptoms of a person experiencing cardiac arrest. So like I mentioned, abdominal breathing or abnormal breathing, it could be a very one of the symptoms. So some standard first aid guidelines according to the American Heart Association and Red Cross. So you want to make sure you call 911 immediately, begin chest compressions, use an AED if available. Most businesses have AEDs around the building. So when you walk into a building, make sure you know where an AED is available, or in your home, make sure you have an AED available, or any private businesses or offices that you may have, make sure there's AED available because they can be very useful. And then you want to continue care until EMS arrives. So if you're doing chest compressions to a victim, you want to make sure you keep going and don't stop until an EMS person arrives, if you're capable of keeping to keep going and not either physically exhausted, tired, or hurt yourself to not be able to go. So some of the risk involved of for a victim and a responder for yourself, a victim can become brain damaged within 4 to 6 minutes of experiencing cardiac arrest. That is a lot. That's a long time. They can also become dead. They also can die without having CPR or using an AED within 10 minutes. 10 minutes is a short amount of time, so it's easy and it's good for someone to step in and react, because they never know what they can do to save someone's life. For responder side, so responding to someone who's a victim, some risk could be exposure to bodily fluids like saliva, urine, or blood, for God's sake, hopefully not, but it's good to use some protective equipment such as gloves. But if you don't have any gloves or anything near, it's okay. It's okay, but that's some risk. It's just very risky for you as a responder. And then some legal concerns. Some people are afraid that if a person they're responding to a victim might have a DNR order, but you won't know because you're not legally trained to know those or have those legal documents. But those are some risks. People are afraid to help someone that is a victim of cardiac arrest because they're unsure if a person has these legal documents in place where they don't want to be rescued, or they don't want to be safe. But good thing we have laws to protect responders or people who wants to help, which is the Good Samaritan law. So if a lot of people don't know about the Good Samaritan law, and I feel like they should, because it's okay to help someone if you know or if you don't know that they have some special order in place. So here is the step-by-step emergency plan. We put together a step-by-step emergency plan so you don't have to remember or think about what to do. So step 1, ensure the scene is safe. So we're gonna have, if you see someone or you suspect somebody is experiencing cardiac arrest symptoms, you want to make sure you look around and make sure there are no immediate dangers. So any cars or car crashes if they're in the middle of the road, fires, glass, needles, blood, oil spills. You want to make sure the scene is safe for you, because you can't help nobody if you're a victim too. So just don't rush in if the area is unsafe, or if this is just unable to go in and help somebody. So that's step one. So we're gonna have Plushie here to be our little model, our little example. So now Plushie's about 2 feet. Plushie's about a foot and a half. So we can't get on the ground with Plushie, but we're gonna use this. We're gonna use this chair as an example for Plushie. So Plushie is gonna be our victim today. So step two, we have Plushie here. So Plushie is out on the ground. I'm gonna walk in and ensure that the scene is safe. I've checked that the scene is safe. Okay, so you wanna check for responsiveness. You wanna make sure you tap them. You wanna tap and shout, "Are you okay? Plushie, are you okay?" Plushie's not responding. So if you don't have a response, you want to check for breathing and check for a pulse. And you want to do this for 10 seconds max. So if you have a watch on, a lot of people walk around with Apple Watches, or they have phones near them, you want to at least count out loud too. So you want to check for breathing, listen to the listen to the mouth. Look at the chest, see if it recoils. No, check for a pulse. You can check for a pulse right here, or you can check for a pulse on someone's arm. I don't see it. So immediately, you want to call 911. So if you have a cell phone on you in your pocket, hey Siri, let me not activate that. All the things you want to say, hey, call 911. When you call 911, you want to make sure you tell them the location with the landmarks. Hey, I'm outside near ice cream shop XYZ. You want to make sure you describe the victim. The victim is 2 feet tall, green, yellow with red eyes. You want to say what you're doing. I'm about to begin CPR and I think an AED is on the way. And you want to stay on the phone with the dispatcher until EMS arrives. So a lot of times they can help you and guide you through CPR if you're untrained or if you're unsure. They can tell you what exactly to do, how to do the hand placement, count out loud when you do your compressions. They're very, very a good resource. Now, if you don't have a phone, you need to make sure you call out to someone. Don't say someone, but insert someone's name or description. Hey, you, Beth, can you call 911 and get an AED? Don't know whose name is who, or if in this case, we're in public. You want to be very descriptive as possible. So, hey, you, lady with the red hair and the orange dress, call 911. Hey, you with the black pants and the gray hair and the backpack, go get an AED. You want to be very descriptive as possible, because if you're in a public place and you're just yelling out stuff, a lot of times it's a lot of people, it's loud, they won't be able to hear you. And whenever you be very direct and clear, you have that one-on-one clear communication with the person, they know exactly, oh, she's talking about me with a purple shirt and black pants and a purple Crocs. Okay, let me go call 911, or let me go get an AED. So step 4, we're gonna start CPR. So when you do CPR, you wanna do CPR in the center of a person's chest, and you want to do 100 to 120 compressions per minute. And you want to go at least 2 inches deep into the chest, and you want to allow the chest to fully recoil. So in this case, a person will be lying on the ground. Hopefully you can still see me. And you want to be on your knees, and you want to be on the side of the person. You can't be on top of them, because that's kind of awkward. But you want to be at least on the side of them, and when you do them, you want to make sure your hands are clamped like this. And you want to go 2 inches deep and allow the chest to fully come back up. So I don't know if you can see me, but we're gonna do the chair, for example. Put it like this side. So you want to be at least 2 inches deep, but allow the chest to fully come back up and release. And you want to do 100 to 120 compressions, pumps. A lot of people call them pumps, but compressions per minute. So you want to make sure you count out loud. 1, 2, 3, 4, 5. And you want to make sure you use the the bottom of your palm, not your fingers, because your fingers you can break your fingers, or you can get injured and get cramped. So you want to use the bottom of your palm and ensure that you're doing, let me let you see the screen, ensure that you're doing CPR chest compressions. So you're going to make sure you count out loud. Let's say 100, 120, boom. All right, AED came. Thank you, Beth. Beth gave me an AED. Now, I don't have an AED on hand, but I have some 2 examples. So these are like the AED pads. So AED is like a little machine, and you want to make sure you turn it on, and it's going to have a voice. It's going to give you some instruction. You want to attach the pads to the upper right chest and lower left chest. So these are the little pads, and it's connected to a machine that's gonna talk to you. You wanna make sure you take the stickies off, rip what's your plushie's clothes off, and attach the pads right here and on the upper right part of the chest and the lower side. Ensure no one is touching. Everybody step back, step back. Uh-oh. And the machine is gonna be like, deliver, the AED is gonna say deliver, shock advised, and it's gonna like shock plushie. So, but you need to make sure you're not touching plushie or no one is near plushie, because you don't want them to get shocked either. So it's gonna deliver the shock. 3, 2, 1, shock. All right. The AED is gonna say resume chest compressions. All right, take the pads off. We're gonna keep compressing. So you wanna continue to do CPR, literally just like this, counting out loud though, not talking. You wanna keep doing the cycles of 30 compressions and 2 breaths if trained. A lot of people don't wanna do the 2 breaths because they're not trained, or they are having fear of risk, such as bodily fluids, saliva, which is okay. So just continue to do the compressions if you're not comfortable or trained to do the 2 breaths. So do not stop CPR until EMS arrives. But you're doing CPR correct. Woo! Squishy's starting to become conscious and starting to be able to talk. You want to make sure you roll them over into the recovery position. So in this case, it will be on their side. So I'm going to roll Squishy over to their side and make sure their top leg is bent. Squishy got low legs, so Squishy leg is bent. You want to sit here and monitor their breathing and monitor their pulse. So you want to make sure you're checking, you're counting, and you want to make sure and during this process, you want to make sure you stay calm and reassure the victim that they're okay while waiting for EMS to still arrive. So the person that's calling EMS, they send it on the way, or if you still have your phone, talking to them, be like, oh, well, they just got gained conscious. Let me check for a pulse, count. Plushie, it's okay. It's okay. Okay, Plushie's saying they're fine, so they regain conscious. So I place Plushie in the recovery position on their side. I'm monitoring Plushie's breathing, and they're alertless. Plushie is talking to me, having a conversation. Plushie is okay. But now, if Plushie isn't conscious, you want to make sure you just continue to do CPR. You want to do as much CPR you can until EMS arrives. But Plushie's okay. Woo! All right, this is our little Plushie. Plushie's alive, but thanks to our help and thanks to knowing CPR, this is Plushie's way to say thank you. Say thank you. All right, they said thank you. All right, so here are some pictures of how to do an AED. Like I said, we want to make sure we put the pads on the upper right chest collarbone. You want to make sure it's at least 1 inch away from implanted medical devices such as a pacemaker. And then the lower left chest, if someone has breasts, if a woman has breasts, you want to make sure you just put it right underneath there. Don't put them on their nipple, please. It's not going to work, babe. Like I mentioned, for chest compressions, you want to make sure you use your dominant hand. Put your hands between your fingers. Put your fingers between your fingers, the gaps. Close it, and you want to make sure you use the bottom palm. So let me just come closer to ensure, just like this. You want to make sure your hands are overlapping each other. You want to make sure you clamp it. And when you're doing compressions, you want to make sure you're using this part of your hand. So when you're doing compressions like this. So these are some just educational visuals. Like I said, this is the top left was the AED placement, and then the bottom was the CPR. So you might be asking towards the end of the video, why does all this matter? Since it's a lot of work. It matters because it can be you. It matters because it can be your family member. It can be your friend. And a lot of times, most of this cardiac arrest happens outside of hospitals, nowhere near medical places, and in public settings. So you could be at a family barbecue at the cookout, and grandpa all of a sudden just falls out. You could be at a friend's wedding, God forbid, and they just pass out on the floor and have cardiac arrest. And it matters because it can save their lives. Like I mentioned earlier, it can double or triple survival rate. So some work is better than no work. And then I feel like everyone should know how to respond, because like I said, it could be you, it could be your sister, it could be your next loved one, and you just never know. So it's important to ensure that you are aware of the signs of cardiac arrest, one, and how to, the proper steps for emergency action and emergency plan on what to do. Because you never know, it could be your nice little plushie like mine. But because I knew CPR, and I knew the signs, and I knew the symptoms,